Hello friends, I am Dr Amol Lunkad, Chief IVF Specialist, Indra IVF Pune, and I have been practicing infertility and gynae endoscopy since last 15 years. I did my post-graduation from All India Institute of Medical Sciences, New Delhi, that is AIIMS, New Delhi, and I have done more than 19,000 successful IVF pregnancies. Friends, let us understand today what is pre-genetic testing, that is PGTA or PGD. So pre-genetic testing is nothing but testing the embryo outside in laboratory, genetically understanding whether it is healthy or not, and then only genetically healthy embryo can be implanted back into the mother's womb to achieve a healthy pregnancy. So when we are using the advanced treatment of IVF or test tube baby, there you can take the advantage of genetically checking the embryo and implanting back only a genetically healthy baby to achieve a genetically healthy pregnancy. Now how we do that? There are two ways. One is by doing embryo biopsy, that is few cells of the embryo are taken out by doing a small biopsy of the embryo, and these cells are cultured in laboratory, and then this culture is genetically checked, and then the report will tell us the nature of that embryo genetically, and the genetic healthiness of the embryo is identified, and only genetically healthy embryo can be then reposited back, implanted back into the mother's womb to achieve a genetically healthy pregnancy. Nowadays we have non-invasive chromosomal screening or NICS, wherein without doing embryo biopsy also we can check the embryo genetically. How that happens is when the embryo grows from a 2-cell structure on day 1 to a 4-cell structure on day 2 to a 8-cell structure on day 3 to a 300 to 400 cell structure on day 5, day 6. During this growth, few cells come out or are discarded out into the culture media in which the embryo is growing. So the culture media or the surrounding liquid in which the embryo is growing, in these 5 days some cells come out in this media. What we do is take this media, we freeze the embryo, and from this media we take out these discarded cells. And these discarded cells or the DNA material which has come out in the media is then tested in the laboratory to understand its genetic makeup. And thus again we can find out whether the embryo is genetically healthy or not. So especially in females who are having higher age, because we know that after the age of 35, the chances of having Down syndrome, mental retardation, genetic problem in the fetus increases because of the mother's age. Or those couples who are having recurrent abortions, or those couples who are having recurrent IVF failures, or those couples in which there is some known genetic problems. In all such couples, we can genetically check the embryo and implant only a genetically healthy embryo to achieve a healthy pregnancy. So that will not only reduce the chances of abortion, but also will more or less confirm upon us that the pregnancy which the female is having is a genetically healthy one. So pre-genetic testing or pre-genetic diagnosis is one such advancement in IVF or test tube baby which has changed the way we practice, or which has significantly improved the success of IVF or test tube baby. Friends, let us today understand about freezing. So in vitro fertilization or test tube baby, freezing can be used to freeze the wife's eggs, to freeze the husband's sperm, to freeze the embryos which are formed by a fusion of the eggs and the sperm. Even the ovarian tissue, that is the part of the ovary, or even the testicular tissue, that is the part of the testis, can also be freezed. Most commonly which we freeze is the embryos, because the chances of retrieving the embryos is very good. Other than that, the chances of retrieval of the sperm is also very good. And eggs also we can freeze and use later. Now let us see various scenarios or various you can say indications where freezing can be helpful. Especially in males, semen freezing can be helpful if the male has not completed his family and is having some testicular problem, or the testis has some mass, or he's for any reason he is warranted to undergo some testicular surgery. Then he can freeze his sperm prior and then go for testicular surgery. Or if the husband or the male is not completed his family and diagnosed with some cancer and is wanting to go for chemoradiation or chemotherapy, radiotherapy, then we know that chemotherapy, radiotherapy is going to destroy his sperm production capacity for a long time. So before going for chemoradiation or chemotherapy, radiotherapy, males who have not completed their family can freeze their sperm. Sperm freezing is very easy, simple and cost effective. Hardly it costs few thousand, that is 5,000 or 6,000 rupees. Sperm can also be freezed in the males who are not available or who want to travel abroad for a long time, and the female want to use their sperm and achieve pregnancy in the absence of the husband. Sperm can also be freezed if the husband has erection, ejaculatory dysfunction, that is, he may not be sure of giving the sperm at the right time, then he can freeze the sperm whenever he is comfortable to give and use it later. Testicular sperm or sperms which we remove from the testes are again freezed, so that again while achieving pregnancy we don't have to again remove the sperm from the testes. So these are the various scenarios in which semen freezing is important. Now let us understand scenarios in which egg freezing is going to help. So any female who is unmarried and due to social circumstances, due to career, due to education, due to her profession, not wanting to go for pregnancy, not wanting to marry, then she can freeze her eggs. Especially I would recommend that those females who know that they are not going to achieve, want to go for pregnancy or not wanting to go for marriage before the age of 35, then they can check their ovarian reserve or egg producing capacity around the age of 30-32 and think of egg freezing. Because we know that as the age increases, females' eggs are going to reduce in quantity and quality. So if they freeze their eggs at the right time, then they can use it later whenever they want, 10 years later, 20 years later, whenever they want, to achieve pregnancy again with their own eggs. Because we know once her age is above 40, eggs will be almost about to finish. And at that age, achieving pregnancy with one's own egg is going to be very difficult. So these eggs which she has freezed prior, cryopreserved prior, can be used later to achieve pregnancy. Egg freezing can also be a very good option for those unmarried females who are having some cancer, who are having some tumor and wanting to go for chemotherapy, radiotherapy for that cancer. Because we know that chemotherapy, radiotherapy will destroy all the good eggs. So if we freeze the eggs prior and then go for chemotherapy, radiotherapy, then we can use these eggs again to achieve pregnancy when that female is free of cancer. Egg freezing is also a very important option or a very good option for those females who are having severe endometriosis, who are having ovarian tumors and wanting to do surgery on the ovary for that endometriosis or chocolate cyst or dermoid cyst or ovarian tumors, so that we can preserve the eggs and use them later.